Why is gluten not good for us? What are the evidence and implications? Gluten is a complex protein found primarily in wheat, barley, and rye. It forms an elastic network that gives dough its characteristic texture and elasticity, but its structure makes it resistant to complete digestion. This allows immunogenic peptides to persist and potentially trigger immune responses. In susceptible individuals, this can lead to serious health problems. Let's examine the evidence and understand what this means for our health. The most severe condition is celiac disease, an autoimmune disorder triggered by gluten ingestion, leading to small intestinal damage. This damage is characterized by villus atrophy and crypt hyperplasia. The immune response is mediated by specific genetic markers, HLA-DQ2 or HLA-DQ8. Celiac patients have increased risks of coronary artery disease, 2 times higher risk, and small bowel cancers, 4 times higher risk. Non-celiac gluten sensitivity presents different symptoms. Gastrointestinal symptoms like abdominal pain, bloating, diarrhea, and constipation, plus extraintestinal symptoms like headache, fatigue, and mood disturbances. Unlike celiac disease, this doesn't show the same autoimmune markers, but it may involve immune activation and altered gut permeability. Gluten ataxia affects the cerebellum, causing progressive gait instability and coordination problems. The evidence shows gluten peptides trigger a T-cell mediated immune response. This leads to increased inflammatory cytokine production. Studies demonstrate that gluten increases intestinal permeability. This compromised barrier allows harmful substances to enter the bloodstream. Research shows significant symptom improvements on gluten-free diets, especially in patients with HLA-DQ2 and DQ8 genetic markers. Processing methods can alter gluten structure. This potentially modifies its digestibility and immune-triggering properties. Understanding these mechanisms is critical for developing better treatments, and possibly restoring oral tolerance to gluten in affected individuals. A gluten-free diet is essential for managing these conditions, but it carries risks of nutritional deficiencies. Gluten-free products are often lower in fiber, protein, folate, iron, and zinc. They're higher in fats, sugars, and sodium, requiring careful dietary planning. Complete gluten exclusion is challenging due to widespread use and cross-contamination, but advances in understanding help improve diagnosis and management. Understanding gluten's health impacts empowers better dietary choices.